we have a wonderful speaker, Dominic Bastinelli, who is a licensed specialist clinical social worker for the Veterans Administration. And Dominic is going to talk with us today about dementia and caregiver support and what the VA can provide in terms of those things. So Dominic and I'm gonna ask him some tough questions, and he's going to tell us the real truth about what the VA can do to provide some support. So with that, welcome, Dominic. Thank you so much for being here. We're so excited to hear from you. I know that we have lots of folks in our sphere who are interested in this topic, whether they are veterans themselves, or they love a veteran, or they just want our community to have all kinds of supports. And I'll start by saying, to anyone who's connected to a veteran in any way, thank you for your service. It is so meaningful. And I think it is all the least we can do to provide services like what the VA does. So I'm going to quit talking, and I'm going to ask Dominic to start us off by saying maybe an overview, Dominic, of what kinds of things people can expect to receive from the VA when they have a dementia diagnosis and they are caregivers.
Yeah, so I'll introduce myself again. So my name is Dominic Bastinelli, and I'm a program coordinator in our VA caregiver support program, specifically in our program of comprehensive assistance for family caregivers. So we actually have two programs within our umbrella. But so veterans receiving care within Veterans Health Administration, of course, in our area, we have couple of different healthcare systems. So Kansas City VA has their own resources and services. And then I'm actually coming to you today from Leavenworth in our VA Eastern Kansas location here. And then we also have one in Topeka. So for those of you that are potentially, as you talked about, being a little bit further out west, we do have a VA medical center in Wichita. And they cover everything west, everything from Salina all the way out. So they've got a lot of ground they're covering. We do too, but theirs is a lot more rural. So in accessing services, it's good to know what is your closest VA medical center. And if there is a veteran that has not yet been accessing care, you can go to va.gov to see if you're eligible to receive Veterans Health Administration services. You can call your local VA and ask to speak to a social worker. That's okay, or speak to someone in eligibility, and we'll be happy to walk you through kind of what that looks like. We have again, you said resources. It really blows my mind sometimes when I learn a new thing about what's available, and I learn new things every day. I've been with the VA in a variety of capacities now since December of 2012. And so just learning all the time. And we have a geriatric primary care program here, actually, which is just amazing and inspiring to work with those folks. And those teams are very clinically rich. They have their providers are nurse practitioners, PAs, MDs. We also have embedded in those treatment teams psychology staff. We also have clinical social work, of course, as well as nursing and other entities in collaboration with other programs like PT, OT, pharmacy, things like that, specialty care. So a veteran who has any sort of neurological challenge can work with any primary care provider, but as their care needs increase, a geriatric primary care consult is probably going to be in their best interest to stay connected. And stop me if anybody has any questions. I wasn't looking at the chat. So, but that's a really good place to start, because as those folks get engaged in that team, the amount of assessment and review and determination of services that maybe the veteran has not been receiving that they should be, and or just understanding better, what's happening within that disease process and within what they need is, again, just mind-blowing. So geriatric primary care would be, in my opinion, probably a gold standard for that veteran. As things progress, we do also have a program called home-based primary care. in which if it's in the veteran's best interest, or if we're trying to really reduce those recidivism rates, if there's really just, a lot of risk factors that would be a concern for that veteran to have to access the care outside their home, then a home-based primary care referral would really be appropriate for that veteran. And we do cover within, I think the number is 40 miles within the VA medical center. So we have teams in all of our outpatient clinics. We have folks assigned to the VA medical center specifically. And again, each VA medical center has all of these resources. So this is not, I'm not speaking to just one versus another. So that's kind of a good place to start, right? So that's not particularly from a caregiver perspective, as I'm kind of, wanting to talk more about too, but understanding VHA and its just sheer size, and the resources that are available when we're dealing with folks that do have, neurological conditions. Those teams are really, really great to access.
Wonderful. Thank you so much. I've learned so much already, Dominic. I've worked sort of alongside veterans throughout my career, and every time I get to work with another one, I learn something else. And I'm so impressed by all the resources that are available and so happy to share with our audience. I want to ask a lot of questions. My next question for you is, so many folks in caregiving situations are spouses of someone, including veterans, spouses, adult children, all kinds of relationships. And I know just enough to be dangerous about the fact, I think, that spouses of veterans can receive some benefits. Can you say some about that, please?
Absolutely. Yeah, that's my wheelhouse right now. So
Yes, good.
I've been within VA caregiver support. It'll be 4 years in December. So that time has gone by very quickly. But our program consists of two separate, under our umbrella, there's two separate programs. And so we have what's called the Program of General Caregiver Support Services. And I can put a link in the chat to our website that talks about the differences of those two programs. Let's see if it'll let me do that. That might be helpful for folks to reference. That should be helpful there to review for future reference. That's to our caregiver.va.gov website. So we have two programs. One is the Program of General Caregiver Support Services, which really is the foundation of what we offer. So our program has been in existence since 2011, and we've had the opportunity to serve lots of different types of caregivers, but recently we've had an expansion since 2020, being able to serve veterans in more eras, like from Vietnam era and before, and most recently serving really not having the challenge of looking at dates of service as a limitation to which veterans and their caregivers is the customer, right? Who we can actually serve. So the general caregiver program, again, is the foundation of what we're offering. And we have educational opportunities. We have some skills training that we can provide, partnerships with community partners with providing some supports for those caregivers. Internally, we're offering, we have a peer mentorship program where we match up caregivers together. We also have health and well-being coaching, which I'm really just glowing about that. I just think it's a wonderful opportunity for the caregiver to have that opportunity to have that support for their own health and well-being. We have, oh my gosh, the list goes on and on, right? Mental health supports for caregivers. So again, just a ton of resources that are available to them. Now, in addition to that, we have our other program is called the Program of Comprehensive Assistance for Family Caregivers. So that's really looking at a situation where a veteran, their care needs are pretty significant. And so as a result of the extensive nature of that veteran's care, we can offer that caregiver a monthly stipend in recognition of how they're having to sacrifice their own likely, career goals or other things that they have to sacrifice to take care of the veteran, help that veteran to age in place, et cetera. We have an insurance opportunity. We have a CHAMP VA benefit for caregivers. We have extended respite services. There's a number of enhanced benefits that we offer to those in the comprehensive, because again of the extensive nature of the care need.
Sounds wonderful. A buzzword I've heard a lot, Dominic, and I wonder if you could explain it to the audience in case they have or have not heard, is a program called Aid and Assistance for Veterans.
Aid and attendance.
Aid and
Yes.
Assistance, that's what I meant. I was just
Yeah,
making
that's what
it.
you meant. Of course, that's what
Yeah,
you meant. So, and there's probably an acronym, right? So,
right?
because everything has to have an acronym. So, aid and attendance is, and this is where things get so interesting, right? So, again, with the wealth of resources that are available, the Department of Veterans Affairs, for those of you that don't already know, and for those of you that do, just bear with me, but it's broken up into three different pillars. And so we have the Department of, or we have the Veterans Health Administration, we have Veterans Benefits Administration, and then we have the cemetery. So benefits administration, that aid and attendance that you shared, that you were asking about, that program does fall under Veterans Benefits Administration. So if a veteran had an interest, and again, I'm not a benefits specialist, so I got to be careful what I say here, right? This is being recorded. But ultimately, we always advise folks to consult with their preferred service organization. Like, for example, a service organization could be a nonprofit that's assisting a veteran and being kind of an advocate for them to access resources that they're really entitled to. The aid and attendance program could be, there could be a justification in the event where there are some in-home care costs that are creating a financial burden, if you will. Again, I'm not a benefit specialist, but the service organization could put in a request through Veterans Benefits Administration to request additional monthly compensation it's actually going to the veteran to offset those those costs, that are creating a financial stress. So we've got health administration, which caregiver support is under health administration. Okay. We've got benefits, which programs like aid and attendance fall under. And with benefits, your service organization could be an example like American Legion, DAV, VFW. There's a lot of nonprofit organizations that would assist a veteran in helping them to determine that. And with aid and attendance, the primary care team with the VA also has to be involved with that because they have to provide some medical documentation. But that's kind of that's the partnership, right, between both of those pillars of the VA. Great question.
Okay, very good. So now here's another one. And that is, let's say, as some of the folks who may be on this meeting, let's say someone is a patient at a place like, oh, I don't know, let's say KU, for example. Let's say they're seeing someone in the memory clinic at KU and they are also a veteran. How does that work, Dominic? Can they pull from both pots? Do they have to pick one or the other? What should they do?
Absolutely. So if you are working with an individual in your clinics and they do identify as being, or they have military history, if they aren't connected with the VA, we would ask for you to encourage them to reach out to their local VA or just to go to va.gov and see if they're eligible for Veterans Health Administration. The reason I say that is because we send a lot of people to you. We send a ton of people to KU because you all are experts in your field in so many different ways, and we just lack some of those resources that you all can provide. And so we want to not reinvent the wheel. We want to partner with you because that's what's in the best interest of the veteran. So there are veterans who receive both VA and non-VA care. They might utilize their Medicare benefit. They might have TRICARE for life, et cetera, other resources that they can use to cover their non-VA expenses. However, that partnership could be in a situation where maybe your clinic says this individual needs grab bars in their home. Maybe they need a shower chair. Maybe they need another assisted device. Let me tell you, we have them. So we could assist with putting in those orders. And then for a lot of veterans that are eligible for VHA, they would not need to have a copay for those items. So we can provide those items to them at little to no cost versus having them buy them from a medical supply store or just the excessive cost that some of those things can have. Yeah. I was going to say one more thing about that. Oh, medications is another big thing, right? So if your clinics where you all are, if there's a recommendation for a medication, if the veteran is already receiving care at a VA, then those prescriptions can be provided to us. And with a primary care kind of co-signature, we can get those things filled Again, likely at a reduction of cost for the veteran if they do have a copay. Otherwise, many times there could be, no copay.
That is excellent to hear, Dominic,
Yeah.
especially as all of us at the ADRC are especially concerned with growing our research toward developing new medications for all of the dementias, and knowing that those advances come with high price tags in a lot of cases.
Yeah.
So it's so reassuring to hear that veterans might be able to have that extra bit of help to
Yeah.
access
And of,
medication.
and of course, we have a formulary, so we follow a certain, just everyone does, we follow a certain pattern. And so if it fell outside of that formulary, there are ways to request exceptions, for authorization. But ultimately, we all understand managed care. We all get it. We do what's in the veteran's best interest in this specific case. So we definitely appreciate and want your partnership in whatever way we can serve a veteran, and how we can support, again, those caregivers of those individuals as well.
Perfect. I hope everybody has had a chance to see the link that Dominic put in the chat, which is, it looks like kind of the entry point. Is that a fair thing to say, Dominic?
Yeah, so that's a great place to start. It does break down the differences between the two programs that we have. Ultimately, there's like a little checklist. It's a visual there. I'm a visual person. It helps me to understand what someone could get versus what they're not getting. Or not able to get, but ultimately gives an idea of some of those things. And also, if folks are, if they look at eligibility data, which is also, there's a fact sheet there at the bottom of that screen, you can see who would be eligible for the comprehensive program as compared to the general. And I can just, if I may, just talk about that just for a second.
Yes.
Okay, so the comprehensive program, as I mentioned before, is really intended for those caregivers of veterans with pretty significant care needs. And so we assess those higher level care needs as part of a consideration process. And before we get to that point, a veteran does have to be service connected, at least at a 70% rating or higher. And so that's a benefits process that happens. But once that's completed, as long as that veteran has a 70% service connected rating or higher, then that's kind of a starting point, right? So we're not a benefits program, but we trust that benefits have already done a number of evaluations to see what are the areas of disability that are impacting this veteran's life. So what we're looking at in our application consideration steps is really looking at what's happening now. What are the care needs now? And so we go through a number of assessments and getting to know those individuals to find out what that looks like. And then ultimately, we have a centralized eligibility team that makes those determinations. But looking at, does that care need level meet the threshold for the comprehensive program? And if it doesn't, okay, let's capitalize on that veteran's strengths. What can they still do? Let's allow them to still do as much as they possibly can, and we can still support that caregiver with the supports that are available in the general caregiver program. So resources either way.
Sounds like a plethora of resources. And Dominic, I think you might have answered a bit of Valerie's question in the chat, but I want to bring it up for everybody to be aware of, and maybe you can make sure we have the answer. And Valerie is asking, where and how can a surviving spouse determine eligibility for benefits for dementia support at home? And is the link you provided a place to begin?
I would. Well, yes, it could be. Yeah. So if someone submits an application for the Comprehensive Assistance for Family Caregivers program, then even if we determine that they're not eligible to receive care within our team or within our specific criteria, we're going to help to direct in whatever way we can. So I have had multiple conversations where folks have submitted an application. They really didn't even know what they were submitting an application for. And we were able to help them to get connected with the like geriatric primary care, for example. Like, didn't even know what to ask for, but I found this application and thought maybe these folks can help. Yes, we're happy to do that. I would say it is so crucial for a caregiver to be involved, and you all, I'm sure, can speak to this too, but it is so crucial for a caregiver to be involved in the veteran's care. I can't speak enough to that. If we think about that inclusive care model, right, we go back to Elizabeth Dole Foundation, right? Giving us this great, research and helping us to realize the benefits and reducing recidivism rates and how to increase quality of life and longevity with inclusive care. We need to follow inclusive care. We need to have those caregivers involved. And so that would be a conversation that I would have with this individual. So if there was a surviving spouse or an individual who, and I'm assuming when you're saying a surviving spouse, okay, I think I know what you're asking for. So yeah, so looking at inclusive care during those stages of care when the veteran is still with us and still needs that care, but also as a survivor to a veteran who has passed, that transitions more into benefits administration, right? So if a veteran was service connected, for instance, and the reason for the reason for their passing was related to their service-connected disability specifically, then they would be likely entitled to some, it's indemnity. I can't think of, it's DEI. I can't think of what the last word is, indemnity. I always forget what that stands for, but there's always an acronym. But service organizations can assist with that. And although it's not popular, I really do encourage caregivers to understand how that process works before the passing so that it can be less of a reactivity situation and really to be proactive, know who the service officers are that they work with already, potentially what would those steps look like when the time comes. Yeah, I actually talked to somebody about that yesterday. Yeah.
Okay. Yeah. Advanced planning is a good idea.
Yes. Proactivity. Thank you, Valerie, for that question.
Yeah, that was a great question, Valerie. We've got about 5 more minutes. If anybody else has a question or a comment for Dominic. I know this has been super helpful for me. One of the things I learned in social work school and in my career was when in doubt, fill it out. And I think that goes to Dominic's point about even if you have no idea what you're asking for, just go ahead and ask. I mean, the worst they can do is tell you no, but it sounds like they probably won't even say it that way. They'll say, here's what we can do.
Yeah, I focused on that. Yeah, exactly.
So I would encourage all of you. I've been peeking at the link you sent, Dominic, and it looks like a wealth of information, including a support line that's available for 14 hours of the day or so. It looks
yes, I was going to put that in the chat, our caregiver support line. Yes, don't hesitate to give that out to people or just caregiver.va.gov. If you have the number for your local VA, press 0 and ask for the social worker. They'll transfer you to social work service.
Yes.
We want to be a resource to those that are trying to get connected and or that just, again, don't know who to ask. And it's, I don't know what I don't know.
Yep. Yeah. I love that you say just call and ask for the social worker. As a social worker,
that's what I tell people to do as a clinical social worker. Yes.
Right. I don't know if everybody knows that when we graduate from social work school, they hand us a magic wand, don't they?
Right.
And we can just wave it around and help you figure everything out. And I think those who go to social work school are very honored to do that sort of thing. So I've given away all the secrets now.
Sorry, social workers.
Yeah, I know. But thank you so much, Dominic. This has been really helpful.
Yeah, thanks for the opportunity.
New in the chat here. I don't want to miss it. Oh no, it went away, so maybe not. Okay. So everybody take note of the phone number and the website that Dominic has put in the chat. I've saved them too. So if anybody asks me after the fact or anybody that might be watching this, I don't think the chat is available on the YouTube. So anybody, if you're watching this in the future, feel free to send an email to myalliance@kumc.edu if you'd like the phone number or the link that Dominic is sharing with us today. And we'll be happy to share that. And just like I promised you, Dominic, time flies.
It does. And we could talk for a long time about this.
You and me, so, yes, we could. But I just want to thank everyone for being here today. And I want to let you know that next week's topic is one that several of you have asked about. And so I'm happy to deliver it to you. It will be about driving and dementia. I love that face, Dominic. Probably a lot of people made that face. And that is a hot topic, certainly. And we have Kristen Nichols, who is a another social worker who will be with us next week to talk about how to have those hard conversations, what to watch out for, what to do. And so I know that that's going to be really helpful. So that will be next Thursday, same time, same place, 2 to 2:30. Watch for more information in your My Alliance newsletter. I hope everybody has a great week. Go Chiefs. Join us on Saturday for the Spark film with Robin Williams. Join us for one of the Y showings over the next week. And feel free to get in touch if you have any questions or need anything else. Dominic, it's been a treat. Thank you.
Thank you all. Take care of yourselves.
And take care. Bye-bye.
Bye.